The heart is a muscular organ responsible for pumping blood throughout the body, supplying oxygen and nutrients to tissues and removing carbon dioxide and other wastes. It is central to the cardiovascular system and works tirelessly, beating around 100,000 times a day. Anatomy of the heart. Heart is roughly the size of a clenched fist and is located in the thoracic cavity between the lungs and slightly to the left. It is enclosed in a double-walled sac called the pericardium, which protects it and anchors it to surrounding structures. Layers of the heart. Wall, epicardium. The outer layer, also known as the visceral pericardium, which is a thin layer of connective tissue and fat, protecting the heart and providing a smooth surface. Myocardium. The thick, muscular middle layer that contracts to pump blood. This is the bulk of the heart's mass. Chambers. The heart has 4 chambers, 2 upper atria right and left, and 2 lower ventricles right and left. The right atrium receives deoxygenated blood from the body through the superior and inferior vena cavae. The left atrium receives oxygenated blood from the lungs via the pulmonary veins. The right ventricle pumps deoxygenated blood to the lungs via the pulmonary artery, while the left ventricle pumps oxygenated blood to the rest of the body through the aorta. Valves. The heart contains 4 main valves that prevent backflow of blood. Tricuspid valve, located between the right atrium and right ventricle. Pulmonary valve, between the right ventricle and pulmonary artery. Mitral valve bicuspid, between the left atrium and left ventricle. Aortic valve, between the left ventricle and the aorta. These valves open and close in response to pressure changes in the heart, ensuring unidirectional blood flow. Blood vessels. Blood vessels. The major blood vessels associated with the heart include vena cava, carries deoxygenated blood from the body to the right atrium. Pulmonary arteries, transport deoxygenated blood from the right ventricle to the lungs. Pulmonary veins, bring oxygenated blood from the lungs to the left atrium. Aorta, the largest artery that carries oxygenated blood from the left ventricle to the body. Physiology of the heart. Cardiac cycle. The cardiac cycle is the sequence of events in one heartbeat, involving 2 main phases. Systole, contraction phase where the ventricles contract to pump blood out of the heart. Diastole, relaxation phase where the heart muscles relax and the chambers fill with blood. The cycle involves electrical impulses that initiate muscle contraction, starting with the sinoatrial SA node, the heart's natural pacemaker, which generates an impulse that spreads through the atria, causing them to contract. Atrial systole. The impulse then travels to the atrioventricular AV node, through the bundle of His and down the Purkinje fibers to the ventricles, causing them to contract. Ventricular systole. Heart sounds. The lub-dub sounds of the heartbeat are caused by the closure of heart valves. First heart sound S1. The lub sound is due to the closure of the tricuspid and mitral valves at the start of ventricular systole. Second heart sound S2. The dub sound is from the closure of the aortic and pulmonary valves at the beginning of ventricular diastole. Blood pressure. Blood pressure is the force exerted by circulating blood on the walls of blood vessels, measured as systolic pressure. The pressure during ventricular contraction. Normal range 90120 mmHg. Diastolic pressure. The pressure during ventricular relaxation. Normal range 60-80 mmHg. A typical blood pressure reading is expressed as systolic over diastolic. For example, 120/80 mmHg. Coronary circulation. The heart has its own blood supply via the coronary arteries, which branch off from the aorta. The right coronary artery supplies the right side of the heart, and the left coronary artery, dividing into the left anterior descending artery and the circumflex artery, supplies the left side. Oxygen-depleted blood from the heart muscle is collected by the coronary veins and drained into the right atrium through the coronary sinus. Coronary artery disease (CAD) occurs when the coronary arteries become narrowed or blocked due to plaque. buildup atherosclerosis, reducing blood flow to the heart muscle. This can lead to angina, pectoris chest pain, or a heart attack. Myocardial infarction, arrhythmias, irregular heart rhythms, caused by abnormalities in the heart's electrical system. Common types include atrial fibrillation, tachycardia fast heart rate, and bradycardia slow heart rate. Valvular heart disease involves dysfunction of one or more of the heart valves, such as stenosis, narrowing of the valve, or regurgitation. Leakage of blood backward through the valve. Hypertension, chronic high blood pressure can strain the heart, leading to complications like heart failure, stroke, and kidney disease. Congenital heart defects, structural abnormalities of the heart present at birth, such as septal defects, holes in the heart walls, or abnormal heartbeat. Don't forget to like, subscribe, and hit the notification bell for more videos like this on Sagacious Learners.